Hi, my name is Allison Stewart, and I am going to perform a head-to-toe assessment for my health assessment class for Presentation College. I have my patient here today. I have already provided privacy by closing the exam room door to the exam room, and my patient here, NS, has a date of birth of 1/1/1980. I have already checked his level of consciousness when I did call him back to the room. He was aware of person, place, date, and time. His level of consciousness was alert. His mood is good. His personal hygiene, he is clean and well taken care of. His skin color is Caucasian, white, and it is uniform throughout. He has good posture. His mobility seems within normal. And he is able to hear and speak when I'm talking to him. He's able to respond appropriately and speak, giving me the appropriate answers. I am going to, throughout the exam, I'm going to be checking his skin. I'm going to be checking the color, pigmentation, making sure it's uniform throughout. I'm going to be checking the moisture to make sure that it's moist and not too dry. I'm going to be checking the temperature by feeling with my hands to make sure the temperature is uniform and throughout, not too hot, not too cold. I'm going to be checking the turgor, and by doing that I would lift up here, and that is good. I would be also checking capillary refill, and that is less than 3 seconds. And the turgor was released quickly, which is a normal finding as well. I'm also going to be feeling for texture on his skin and checking for any lesions or any lumps or bumps. Okay. Before coming into the room, I have performed a set of vitals. I have gotten his height, which is 5, help me out, I don't remember how tall you were. 5'10.5", and weight is 170, and his blood pressure was 116/78. His, which is within normal, that is to be under 120 and under 80. His respirations were 14, which is a normal finding. Normal is 12 to 20 respirations per minute. And his heart rate was 62, which is also a normal finding. The normal range for that is 60 to 100. His temperature was 98.6, which is also a normal finding. And his O2 saturations were at 98%, which normal is 90% or above on room temperature. I'm going to begin by checking his head and his face. I'm going to inspect his hair, his scalp, and cranium. I'm not feeling any lumps or bumps. I don't see any lesions. He does not appear to have a receding hairline at this point. His facial features are symmetric. Can you smile for me? And frown. Okay. And I'm going to palpate his facial features for any tenderness, checking his sinuses as well, his temporal and his maxillary sinuses. Okay. And that all feels good. Did you have any tenderness with that?
Nope.
Okay. I checked his frontal sinuses as well. I am now going to check his jaw for TMJ. I'm going to have you open and close and move side to side. And I did not hear any clicking, which is a normal expected finding as well. Any pain with that either? Okay. I am now going to start with the vision exam. I'm going to ask you to stand up for me, please, and stand against the wall there. I'm going to have you look at the Snellen chart in front of you. I'm going to have you cover up your left eye. And I'm going to have you tell me the lowest line you can read without squinting.
QRSTU.
Perfect. I'm going to have you cover up the other eye. And I'm going to have you again read the lowest line you can read without squinting.
QRSTU.
Perfect. Okay, I'm going to have you sit back down. And that appears to be at a 20/20, which is a normal expected finding. I'm going to be looking at his eyelids. I'm going to be checking to make sure that they are, that the color is uniform and throughout. They're not too red or white. I'm going to be checking the eyelashes to make sure they're uniform and spread out evenly, while also looking at his conjunctiva, his sclera, his cornea, and his iris. And they are pink in color. Eyelashes are uniform throughout. His corneas and his sclera and his conjunctiva all look normal and clear. I'm going to check his pupil size response. And that finding was that his pupils are equal and reactive to light and accommodation. I'm going to check his visual fields. I'm going to do that by having you cover up your left eye. Okay, I'm going to cover up the same eye on the opposite side, and I'm going to then have you tell me when you can see the object that I'm holding in my hand.
No.
Okay, and we're going to switch eyes, and we're going to do that again.
No.
Perfect. That was a normal expected finding as we were both seeing the object at the same time. I am going to check his sixth position gaze. I'm going, let me have you do that by first looking inward at your nose. Okay, I'm going to have you follow this without moving your head. Okay, and that was performed without any difficulty, and those cranial nerves are intact. I am now going to be checking his corneal light reflex, the red reflex only. And I'm going to be doing that by standing 10 to 12 feet away from his nose, or inches away from his nose. Okay. And that was also appears to be intact for his cranial nerve 3, 4, and 6. I did use that performing with my ophthalmoscope for his red reflux, and the other parts of the exam I did use my ophthalmoscope. I'm now going to be inspecting his ear. I'm going to check externally for any lesions, any tenderness or lesions. And how about that one? Okay. That was both clear bilaterally. I'm now going to inspect the internal ear. By using the otoscope. And the tympanic membrane was visualized and clear. And I'm doing that by pulling up and back on the earlobe. And again, that ear was also clear. So both ears were clear bilaterally and able to be visualized. I am now going to check the lymph nodes for any tenderness. I'm going to first start with the regional occipital, which is at the back base, checking those lymph nodes there. Moving forward to the post-clavicular, the anterior post-clavicle. Nothing's felt there. And the parotid along the jawline. Nothing noted or felt there. Okay. And the recto and the segmental and the submandibular and the supraclavicle. Okay. And no lymph nodes were felt, which is a normal finding. So they're not indicating any inflammation or infection at this time. I'm now going to perform what's called a whisper test. I'm going to stand in front of you. I'm going to have you cover up your left ear. And I'm going to say a word. I'm going to have you repeat it.
Baseball.
Okay. Cover up your other ear, please.
Football.
Perfect. And he was able to hear those, so that was with a normal finding. I am now going to perform the Weber test. And the Weber test, I'm going to strike my tuning fork, place it on the top of your head and tell me when you can't hear the vibrations anymore.
Now.
Okay. And now I'm going to perform the Rhine test by placing it behind the ear first and timing the seconds until you can't hear.
Now.
Okay. And now we're going to go in front.
Now.
Okay. And on this side.
Now. Now.
Okay. And that was a normal expected finding with when the tuning fork is placed in front and having the time on that being doubled is a normal expected finding. Okay, so I am now going to, and I did perform examining the ear with the otoscope as well. I am now going to inspect the nose and look at the nasal structure and the septum. Okay, and his nose is straight and midline. I'm going to look inside the nose, check for patency of the nostrils. That looks good. And it is deep pink, which is a normal finding, as is that side. Sorry. Alright, so I am now going to, I did observe the mucosa, the septum, and the turbinates, and again, the turbinates were deep pink. I'm going to check the patency of the nostril by, holding one nostril closed and having you sniff in. And this side. Perfect, both of those were clear. I'm going to now check for you to identify smell, which is checking your cranial nerve 1. Can you identify this smell for me?
Coffee.
Perfect. That seems to be intact. I'm now going to be checking in his mouth and oral pharynx. I'm going to look in his mouth for tonsils, the mobility of his uvula, and I'm going to be checking for any concerning areas, any lesions. Gums are pink, no lesions in the gum area or the cheeks. Teeth are all in place. Okay, I am now going to have you stick out your tongue. Can you lift it up to your nose, down to your chin, side to side? Checking the muscle strength of his tongue. I'm now going to have you stick your tongue out. I'm going to have you say ah. Looking at his uvula, that looks good and is in midline. He does not have any tonsils as he has had those removed. Any pain or discomfort with your throat at all?
No.
Okay. I'm now going to be inspecting his neck, checking his trachea and his jugular veins for distension. Okay. Looking for distension by using my light here. And there was no distension seen bilaterally. I am now going to check his cervical range of motion. I'm going to have you look down, put your chin down, and up to the ceiling, and to the side, to the other side, and lean your head to the side, and lean your head to the other side, and then go in a circular motion for me. Okay, and he was able to perform that without any difficulty or any pain, correct?
Mm-hmm.
Okay. And now I'm going to be checking his trachea, that is midline. I'm going to check his thyroid gland to see if I can palpate it. And that was not able to be palpated bilaterally. So that is a normal expected finding. I am going to palpate for his carotid artery. And that was palpated on both sides. I am going to also check for his lymph nodes in his neck again. And there are none that are being able to identify, so that is a normal expected finding. I'm going to check the muscle strength of his trapezius by having you I'm going to have you resist my hand, going back and going forward. and that is a normal expected finding. He was able to perform that test. I'm also going to check the sternomastoid by doing the same thing. Okay. And the other way. Okay, and we're able to feel those muscles working, which is a normal finding as well. Now I'm going to auscultate for some carotid bruits using my bell. And there was no sound heard on that auscultation, which again is another normal finding. I'm now going to begin examining the upper extremities. I am going to check for the strychnosis by having you identify the object in my hand. I'm going to have you close your eyes. I'm going to put the object in your hand. Can you tell me what that is?
Paperclip.
Okay. Now keeping your eyes closed, I'm going to draw a number in your hand. I'm going to have you tell me what that number is.
4.
Perfect. Both of those were intact. I'm going to now check your range of motion on your shoulder. I'm going to do that by having you lift your arm up, down, side, side, back behind your back, and behind your head. Okay, and all the way up, and down again. Okay, and the other side will go up, down, forward, backwards, and behind your back, oops, sorry, and behind your head. Okay, and both of those muscles seem to be intact for muscle strength for his shoulders. I'm going to check the muscle strength on the deltoid and the bicep, tricep. Deltoid first, I'm going to have you push up against my hands. And I'm going to try and push down and you resist. Okay, that was good. And I'm going to have you push your arms out. Okay, and go in. Okay, perfect, and that was good. I'm going to check the bicep and the triceps by having you go against my hand, sorry, and the other way. All right, and again on this side, and there, and now using this way, and the other way, and on this arm. Perfect. That was uniform throughout. I am now going to be checking the range of motion on your elbows. So, okay. And this side. Perfect. And your wrists. And fingers open, close, thumbs open and close. Perfect. Yep, we'll do the finger test. We're gonna go 1, 2, and then the other way. Perfect. Any pain or difficulty with that?
No.
Okay. And I am going to test your wrist strength. So I'm gonna have you go against and that way. Perfect. And I'm going to have you do that with the fingers as well. Go against me. Perfect. Okay. And so I have checked the muscle strength on your deltoids, your biceps, triceps, your wrists, your shoulders, your fingers, and your thumbs by going in and out with your thumbs. Can you do that as well? Perfect. Can you resist? And this way? And this way? And this way. Perfect. And do we do the fingers? Perfect. Okay. And I'm going to check his radial pulses on both of his wrists. And both pulses were felt and are 62 and regular bilaterally. I'm also going to check his brachial pulses. which is also 62 regular and uniform throughout. I am now going to perform the reflexes on his biceps and his triceps. Alright, perfect, that was good. And I'm going to now palpate for any pain or tenderness. No? Okay. Vibrations, anything there? Okay. Okay. I am going to inspect his posterior chest. I'm going to be looking to make sure it's symmetric, which it is symmetric. I can see sitting here, sitting straight up. Spinosus process is midline and good. Any tenderness or pain, oops, I'm posterior, sorry. Again, looking for symmetric, and I'm going to be checking to make sure he's midline, and it is. Any pain or tenderness as I'm palpating around here?
No.
Okay. I'm going to feel for any bulges. I'm not feeling any bulges anywhere. So that's good. I'm going to check thoracic expansion. I'm just going to have you turn slightly for me, if that's okay. Scoot forward just a little bit if you can. Perfect. Okay, I'm going to have you take a deep breath in, checking for your thoracic expansion. And again. And that was felt equally bilaterally, which is a normal expected finding. I'm now going to check for his tactile firmitis. I'm going to have you say 99 over again until I tell you to stop. Starting now.
99, 99, 99, 99, 99.
Okay, and vibrations were felt uniformly and throughout. I'm now going to go to the anterior chest, and I'm going to check his respiratory movement for symmetric and retraction. Just take a breath for me. Okay, and it is symmetric. There are no retractions seen. I am going to check for his thoracic expansion again, doing the same thing. Take a deep breath in. And one more time for me. Okay, and that was both uniform and bilateral as well, which is a normal expected finding. I'm going to do the tactile firmitis again. I'll just have you say 99.
99, 99, 99, 99, 99.
Perfect. And that was again felt uniform and throughout. For a breast exam, I would advise my patient, both male and female, to lay back on their backs and with something underneath their shoulder blade. With the one arm raised, I would have them instruct them to go either in circular motion around all areas of the breast or in a vertical motion as well, and horizontal. Covering all areas of the breast, feeling for any lumps, bumps, or any changes. Again, I would also have them do that on the other arm as well. And for females, I would have them stand in front of the mirror and bend at the waist. And then also their arms over their chest and look for any dimpling or changes in their breast areas as well. And noting any lumps or bumps that they might feel and getting those checked out if they did come across anything. So I am now going to move to the anterior chest bilaterally. I'm going to listen for the apical pulse. I'm going to check for the rate and the rhythm, listening for 30 seconds. Okay, and it was heard, rhythm was normal, and it was at 64 beats per minute. Oops. And then now I'm going to check the bell 5 position. I'm going to start with the apical, and I'm using the bell position on my stethoscope. Okay, apical, palmatic, Erb's point, tricuspid, and mitral. Okay, and all of the pulse was heard throughout on all areas, and it was louder on the first two than it was on the bottom two, on the upper. And I'm going to also check again and listen with the diaphragm on the 5 positions using the diaphragm, the other side of my stethoscope. Starting again with the apical, palmatic, or pulmonic, Erb's point, tricuspid, and mitral. Okay, and again, that was normal and uniform throughout, and it was heard louder on the first two than it was on the bottom two. All right. I'm going to check for the axillary lymph nodes at this point, underneath the armpit there, feeling for any lymph nodes. And there were none found on that arm. And none found there either, which is a normal expected finding. I'm now going to have you lay down for me rather, and I'll put this out. And now I'm going to begin inspecting the abdomen. I'm going to be looking for the contour, symmetric, pulsations, the skin, the umbilicus. The skin is uniform, the color is uniform with the rest of his body, the temperature is also good and normal with the rest of his body. Umbilicus looks good, there's no lesions, lumps, or bumps that are able to be seen. I am going to listen to all 4 of the quadrants for bowel sounds. And there were minimal bowel sounds heard, which is a normal expected finding. I am going to check for, any aorta bruits. And there was nothing heard, which is a normal expected finding. Okay, I'm going to palpate all 4 quadrants. I'm going to start with a light palpitation first. Any pain or discomfort?
No.
Okay, and now I'm going to go to a deeper palpitation. All 4 quadrants again. Any pain or discomfort with this?
No.
Okay, now I'm going to percuss all 4 quadrants. Okay, and that was normal as well without hearing anything concerning. I'm going to check the inguinal area for any bulges, lesions, things like that. I'm going to check the inguinal lymph nodes by going horizontal and following the horizontal and vertical chain. I'm going to also instruct my patient. I'm going to check for a femoral pulse as well, and that was felt, and felt bilaterally. I'm going to instruct my patient to go ahead and perform a self-testicular exam, looking for any lesions, lumps, bumps, or anything abnormal finding, whether it looks different or feels different. I'm now going to start with the lower extremities, and I'm going to check range of motion for the hips, the legs, the knees, the ankles, and the feet. I'm going to have you first run your heel, starting at your kneecap all the way down your tibia there, on both legs for me, and see if you're able to perform that task. Okay, any difficulty or pain when doing this?
No.
Alright, that's a normal expected finding. Okay, I'm going to have you sit up for me. Okay, and I'm going to first check the muscle strength on your legs. So I'm going to have you check with the hamstrings. I have you resist. Okay, and going back the other way. Good. And on this leg, resist my pushing. And this leg. Perfect. Those are both intact. I'm going to have you stand up for me, please. And I'm going to check your hip range of motion by having you extend your leg out and in, other side too. Okay, forward and backwards. we're limited with space here, both legs. Okay, and I'm gonna have you check by lifting your knees, legs up and down. Okay, can you go back that way? On the other leg as well. And that knee up and down. Okay, and out in front. Out in front with the other leg. Okay, and then I'll have you sit back down. We'll check your ankles. So I'm going to have you move your ankles up, down, and rotate them. Okay, and I'm going to have you wiggle your toes with your sock, normally barefooted. And I'm going to now test your ankles by having you resist my pushing down. Okay, and then I'll go the opposite way, push down against my hand.